a lot of people are going to realize that if in the case of that baby, the features for this chromosomal condition are very evident and need a lot of medical attention, then this would go against her narrative. So a lot of people are saying on the internet that they don't understand why people are talking about the chromosomal condition that Gypsy allegedly could pass to her unborn baby. I feel like they're confused because some of them say she shouldn't have been having kids, and I am not going to be giving my opinion on that. My opinion on that is very personal, and that is because as an experienced surrogate, as somebody who has experience in the surrogacy field, I have consulted intended parents and I have consulted other surrogates, and just because of certain embryo quality, it does not mean that the intended parents shouldn't have children. That is up to them. I do recommend surrogates to not match with intended parents that do not show them results of PGTA testing and results of grading for embryos before matching. A lot of these intended parents are hesitant to show results because a lot of surrogates are educated. But I will talk a little bit more about that while I'm doing a commentary for this whole entire thing. The whole point is that this is not about telling Gypsy Rose don't have kids. This is about, if the reason why people are being so loud about this subject is because if baby comes out with these chromosomal condition, a lot of people are going to realize that if in the case of that baby, the features for this chromosomal condition are very evident and need a lot of medical attention, then this would go against her narrative. And this would make people question Gypsy Rose even more, because people would think that a lot of the things that she went through were actually really necessary, and that anything else that was not necessary and was a scam, she could have just easily escaped from it by calling 911 or telling a relative, hey, I don't need this stuff anymore. Can you please pick me up? I want to live a normal life. But no, we are going to show a lot of information that I found online. Remember, everything that I show and talk about in these videos is alleged, my opinion, my reaction, and my insight. Again, people are being loud about this not because they think Gypsy shouldn't have kids. It's because the end result of everything when baby comes out may actually go against her narrative. Let's begin. Welcome to That's Just Sarah. This is Tara's mom. You're going to be able to find this video in the playlist IVF, infertility, and surrogacy, and reactions. In my opinion, we're going to be able to use these screenshots and videos for research purposes, accompanied by extensive commentary for the purpose of intended parents and other people that want to learn more about the Gypsy Rose case and the possibility of this condition be passed on to her child. It is alleged, it is being said, I am not sure this is 100% correct because I talked about it in my last video, that she sent a message to somebody saying, hey, I acknowledge that there's a possibility that my child may come out with this. And in other words, from what I could understand, she may be worried about what people may think if her baby may actually need all of these medical attention. Will this change the perception of her? Because in reality, she needed a lot of these surgeries. Let's pay attention to what I researched, and you make your own judgment. So please excuse me if I mispronounce something. My first language is Spanish, so we're just gonna have to go with the flow, and I will beg you for your forgiveness when it comes to that. Okay, so we have here 1q21.1 micro deletions. Okay, it says here a 1q21.1 microdeletion is a very rare genetic condition in which a tiny piece is missing from one of the body's 46 microsomes. The tiny missing bit raises the risk of learning behavior and mental health problems and physical abnormalities. So by that, now we understand, right, that there is a risk for any type of physical restrictions that will possibly require medical, right? So, and this is probably the situation that Gypsy right now is, well, possibly scared. Remember, everything here is alleged, my opinion, my insight, my assumption. She might be scared, and God forbid that, if the baby comes out with these chromosomal condition, the people will actually start questioning her even more, because a lot of these medical procedures that she actually went through were actually necessary. And we heard also that this is alleged that her dad carries it, and he possibly passed it on to her, and she may pass it on to her baby. Okay, so let's continue. It says here, but there is a wide individual variation. Individuals with a 1q21.1 microdeletion range from people with no symptoms to others with developmental delay and health problems. Okay, so it says here, genes and chromosomes. Our bodies are made up of billions of cells containing tens of thousands of genes. Genes act like a set of instructions directing our growth and development and how our bodies work. Genes are carried on structures called chromosomes. There are usually 46 chromosomes, 23 inherited from our mother and 23 inherited from our father. So we have two sets of 23 chromosomes in pairs, apart from two sex chromosomes, two X's for a girl and an X and a Y for a boy. The chromosomes are numbered 1 to 22, generally from largest to smallest. Chromosome 1 is the largest of the chromosomes. Each chromosome has a short arm on the left on the diagram, and at the bottom of page 3, called P from petit, the French word for small, and a long arm called Q on the right. Okay. And there is some information here that you guys can actually look at. I will post the link in the description. Okay, so it gives you here some information about the sizes. It indicates here, are there people with a 1q21.1 microdeletion who have developed normally and have no health, learning, or behavior difficulties? Yes, there are. The 1q21.1 microdeletion can be silent. Some of the parents of children with a 1q21.1 microdeletion have the same microdeletion but not have any unusual features, delayed development, or behavioral problems. Other parents who also have the deletion are extremely mildly affected. Some children with a 1q21.1 microdeletion also develop normally. Most likely features. Okay, before I get into that, I wanted to discuss that there's a possibility, again, this is just a summary, and my interpretation and my commentary of what I just read here, that if the baby has the condition, if the baby comes out with a chromosomal condition, there's a possibility that it may actually be silent, or it may be very evident in a lot of ways, and it could be detected, through facial features, head features, and some other conditions. Okay, so, and these are some of the features. Okay, we have here small head. You can go ahead and read that through the link below. We also have here increased risk of developmental delay and learning difficulties. We also have slightly unusual facial features. We also have here heart problems. Okay, it says here, it is uncertain whether having a 1q21.1 microdeletion puts a baby at risk of being born with a heart problem. Some researchers have found a high incidence of heart problems, but others have not. But this would be the possible list of defects and abnormalities. We also have here loose joints or double jointedness. We also have here increased risk of behavioral or mental health problems. It says here, children and adults with a 1q21.1 microdeletion can be affectionate and sociable with no behavior problems, but as a group, they appear to be at risk for a range of behavior difficulties and mental health problems. It says here, we do not know yet whether these unusual behaviors and mental health problems are a result of the 1q21 period 1 microdeletion or a chance association. This is particularly true when a parent and a child have similar behavior pattern and both have 1q21.1 microdeletion. Let's read that again. This is particularly true when a parent and child have similar behavior pattern and both have the 1q21.1 microdeletion. Okay. Let's see. So let's say, for example, that she is if she carries it, right, and if she passes it on to the baby, there is a possibility that the baby may experience the same behavioral features that she has. That is, if those behavioral and mental possible issues are actually linked to the chromosomal condition. Okay, let me see what else it says here. The increased frequency of behavior difficulties suggests vulnerability in this area and means that children and adults should be monitored and families offered early support. The key concerns that have emerged so far are listed below. Attention deficit with hyperactivity. This has only been observed in children with learning difficulties and developmental delay. And I am not a doctor. I cannot give professional advice here whatsoever. There's no professional advice whatsoever in this video. But the attention deficit with hyperactivity disorder, in my opinion, this is only my opinion, because I have met people that have the condition. They often lie a lot, and sometimes for the silliest things that are not even necessary, that even wouldn't even put them in trouble. But they, for some reason, they lie a lot, in my opinion, that is, to avoid confrontation. That confrontation is, I guess it's like very overwhelming to them. And they just really avoid it at any expense. That's in my opinion. Okay, here it says also antisocial behavior, aggressiveness, autistic-like behavior, anxiety, depression, hallucinations. That's interesting. It says here schizophrenia is more common with people with 1q21.1 microdeletion than in the general population. Excuse me. It is possible that the small head size may be somehow involved, but the link is not yet clear. People with the IQ 21.1 microdeletion and schizophrenia respond to neuroleptic drugs in the normal way. Okay, it says here unique families report marked mood swings in their children with fierce temper outbursts, screaming aggressive, and stubborn refusal to conform. However, patterns vary in children, and adults can also behave delightfully. Okay, it says here, here's an example. It says here, on a good day, he's such a light in our lives. He can certainly make anyone laugh. She can be engaging, charming, fun, loving, and affectionate with a good sense of humor and of rhythm. She's totally innocent with no guile, totally honest and living in the moment. But she's very Jekyll and Hyde and has a prolonged screaming outburst lasting up to 3 hours at a time. Do you think that sounds familiar to you guys? I know I don't have my comments turned on, but just if you feel like you agree with some of the things that I say, feel free to hit the like button because it helps create awareness. It helps push the video out there, and it helps create awareness. Okay. Other features: seizures, disturbances in the lens of the eye. It says here cataracts. I think I heard that she had an eye surgery, but I don't know if it had to do with this specifically. I'm going to go ahead and read it. Disturbances in the lens of the eye. Cataracts, clouding of the lens of the eye have been seen in 5 out of 44 people with a 1q21.1 microdeletion, including 2 sisters, although their father, who also carries the deletion, had no cataracts. Excuse me if I am mispronouncing it. Cataracts have not been seen in unique members with the deletion. The type of cataracts varies from being dense and diagnosed at birth to subtle cataracts only found after a specific search. Cataracts that cause no visual problems do not need treatment, but if the cataract affects vision, surgery to remove it is usually considered. A gene called GJ88 has been identified that may contribute to problems with the lens of the eye. See diagram page 3. Okay. In people with a 1q21 microdeletion, other eyesight problems include long or short sight, a squint strabismus, okay, Duane anomaly, restricted turning of eye associated with narrowing of the eye, abnormally small eyes, dislocated eyes, coloboma, developmental defect, and double vision. Some problems can be corrected with glasses, although some children will not tolerate wearing them. Other problems such as squint can generally be corrected with surgery. Unique has one member with this deletion who is registered as blind. Okay, it says here increased risk of other inborn anomalies. This is very interesting. I'm going to make a pause. This is very interesting for those who are watching that are currently in college or intended parents that want to learn more about any type of chromosomal conditions. This is great for research and education. Okay, let's keep going here. A wide range of other or more serious conditions identified at birth have been seen, but they don't seem to follow a particular pattern. They include missing ribs, extra fingers or toes, webbed or incurving toes, club feet, unusual brain structure, hydrocephalus, increased fluid in the brain, minor genital anomalies, birthmarks, tongue tie, hernia in the groin, cleft palate, lung malformation, small kidneys, renal hypoplasia, which can also have abnormal tissue, renal hypodysplasia or absent kidneys, renal agenesis. Excuse me if I'm mispronouncing anything. Okay. At birth, it says here, among unique members, babies, even brothers and sisters, are very different at birth. Some babies are born small and light, while others have grown well in the womb and are a good size at birth. Some babies have physical anomalies, while others are perfectly formed. Apgar scores, a measure of well-being with a score out of 10, range from low to full marks. Some babies have feeding difficulties, problems latching onto the breast, and bring their feet back frequently. Other problems noted by unique members among newborn babies are mild jaundice, a blocked tear duct, coughing up blood, and gasping for breath, and suspected deafness. Feeding. Among 5 unique members, all have had feeding difficulties. These have included sucking weakly at breast or bottle, bringing feet back, lack of appetite, choking on lumps, failing to chew, gastroesophageal reflux, delayed gastric emptying, uncoordinated swallowing, and tongue thrusting. While 3 babies were breastfed in one instance using techniques for babies with low muscle tone, others needed tube feeding and treatment for reflux. So this puts me to think that these tube feeding may actually have been necessary. Allegedly, from what we have seen, I don't know if it's something that she was born with, right? Because of all of these stuff, and because of all the things that may come along with feeding difficulties, like the esophagus issues and everything, she may actually have needed this. I am not sure. I am just really digging into this whole case, right now, not like I did, a few months ago. Okay, so it says here, let's continue over here where it says, let's start this sentence again. These have included sucking weakly at breast or bottle, bringing feet back, lack of appetite, excuse me, choking on lumps, failing to chew, gastroesophageal reflux, delayed gastric emptying, uncoordinated swallowing, and tongue thrusting. While 3 babies were breastfed in one instance using techniques for babies with low muscle tone, others needed tube feeding and treatment for reflux, including a low allergen meal formula. 2 babies' feeding difficulties were so severe that they were fed for a time by gastronomy tube direct to their stomach. One of these babies was born with a cleft palate, a hole in the roof of the mouth. 2 babies grew into very picky eaters who accepted only a limited range of food textures. Or what I'm thinking is maybe she was born with this and she had to use this. I don't know if there might have been a point in time where she was free to really like not use it anymore, or maybe she had to use it just a few times. I don't know. I am not. I don't have a medical degree or anything like that. But I don't know if this was used also by the mom as as a reason to like try to keep extending it, so she could participate in more scams. But in that case, if Gypsy was aware of this, like I said in my last video, and if she was tired of the scams, if she was very intelligent enough to form romantic relationships, she could have been intelligent enough to also come out and call her relatives or call 911, whoever, to let them know, I am tired of living these scams. Even though I needed this, medical attentions. Once I don't need them anymore, I'm tired, I want to go. But what she did to unalive her mom is just not justifiable. Not justifiable at all. Okay. Then we have here growth. We have here health and well-being, hearing. Okay, and we have some other information. Then we have, oh, it says here, can it happen again? Where both parents have normal chromosomes, it is unlikely that another child will be born with a 1q21.1 microdeletion or any other chromosome disorder. Very rarely, excuse me, less than 1%. This is in the case that none of them were, had it. Strange stuff, It says here, very rarely, less than 1%. Both parents have normal chromosomes by a blood test, but a few of their egg or sperm cells carry the microdeletion. This is called germline mosaicism, and it means that parents whose chromosomes appear normal when their blood is tested and can have more than one child with the deletion. In families where 1q21.1 microdeletion has been inherited from a parent, the possibility of having another child, either a girl or a boy, with the 1q2.1 microdeletion rises to 50% in each pregnancy. However, the effect of the microdeletion on the child's development, health, and behavior cannot be reliably predicted. Your genetics center should be able to offer counseling before you have another pregnancy. I think this is why I heard, this is a rumor, alleged, that Gypsy Rose had said that, or acknowledged that there was a 50% chance, and that she was scared that she would pass it on. And again, the reason why a lot of people are speaking out about this, it's not because if she knew or if she didn't, then she should have been, she shouldn't have had, gotten pregnant. It's not that, because everybody, it's not illegal to have a child with 1q21.1. It's not that. The whole point of the people speaking up about this situation is because this would go against her narrative. All the story that she gave to a lot of people, saying that she was forced to all these medical things and medical surgeries just because the mom wanted to be part of a scam, is going to go against what the possibly passing of these chromosome condition to her child will do. God forbid it doesn't get passed on, and God forbid, if it does get passed on, hopefully the baby has, a silent one, and baby won't need any medical care. But if the baby does end up needing medical care for any of these possible features, then she would be worried that people will find out that all these things that she was going through were possibly necessary. And then she would be worried about people not feeling bad for her anymore and discovering that she used this as an excuse to unalive her mom, when in reality, these things allegedly could have, possibly been necessary. Okay. And here's some more information, right? I'm going to go ahead and move on to the next. Okay. I do have a lot of knowledge in surrogacy, because I am an experienced surrogate, and I do talk a lot about PGTA testing in my videos and how important it is for intended parents to do this. And I have also emphasized and highlighted many times in my videos that there is no test that is 100% reliable, and that some of these genetical conditions may go unnoticed. No medical advice. Okay, I googled, can microdeletion be detected through PGTA testing? It says here, and this is and you need to do your own research. Do not rely on what I am saying 100%. This is no medical professional advice. It says here AI. No, pre-implantation genetic testing for aneuploids, PGTA cannot detect all microdeletions. Aneuploid, let me explain to you what aneuploid is. Aneuploid is a mixture, and I have talked about this before in my channel, a mixture between euploids and mosaics. Euploids are normal embryos. Mosaics are abnormal embryos, and aneuploids are a mixture of both. Okay, it says here PGTA can't detect small missing or extra pieces of chromosomes, also known as microdeletions or microduplications. PGTA is a procedure that involves removing a single cell or a small number of cells from an embryo to test their DNA for chromosomal abnormalities. Embryos without chromosomal abnormalities are then placed back in the womb. Even with a normal PGTA result, a child may still be born with birth defects. This is because PGTA does not detect all genetic changes or changes that aren't related to chromosomal or single gene abnormalities. This is what I have said many times. This is good information for intended parents of surrogacy. I always say this, I always talk about this in my videos, and this is the reason why I am not liked by people, because I don't cover the sun with the palm of my eyes, but this is very important for intended parents to understand. And this is why I always tell surrogates, and you will see this all the time, almost every of my videos. I do not recommend surrogates to accept doing a transfer of an embryo that has not been PGTA tested. And a lot of intended parents will tell you, oh, my embryo was PGTA tested, but they don't tell you, and they don't want to show you what the result is. Do not match, in my opinion, no medical, no professional advice whatsoever. Do not match with intended parents that cannot show you proof of euploid results before you match with them. I do not recommend surrogates to match with intended parents that do not show grading results before matching with intended parents. Why? Because you are going with the possible most excellent or good to excellent embryo that you can go with an embryo transfer, because not every test is 100% accurate, but you want to go with the most good quality that you can go. Anyway, let's move on from this. I looked up, can an anatomy scan detect microdeletion? It says yes, ultrasounds can be used to detect certain microdeletions, but not all of them. Let me see if a 1q21.1. This one is not here, not listed here. This one is point or period too. But it says here, but you have to do your own research. I'm just telling you what I am seeing here. It says here, that some of them can be, but the one listed that what I saw could be related to the one that Gypsy may have. This is alleged. It's not listed here, but it says here that other tests that can be used to detect microdeletions include an expanded NYPT, which is a screening test that screens for 5 chromosomes pairs and may detect specific microdeletions. Chromosomal microarray analysis, CMA, can detect microdeletion syndrome. Multiplex ligation probe can detect. Okay, and okay, it's a little bit hard to read, but I want to let you guys know of these. A lot of these tests, they might tell you, I don't know if they might be covered by a certain insurance, and if not, they may be really expensive too. And I don't know if this may be a showstopper for some expecting parents. Not sure. Let's go on to the next here. So I ended up on this article too, from What to Expect. And okay, it says here microdeletions are chromosomal abnormalities that can but don't always cause health problems. By detecting them in prenatal tests, you can prepare before baby's test. But not everything can be detected. Not every test is 100%. So the parents may find out later in life. Okay, what is a macrodeletion? Macrodeletion is an abnormality that occurs when a piece of a chromosome is missing. Okay. It says, how common are they? Unlike chromosomal abnormalities, which are most likely to occur in moms with certain risk factors, such as those who are 35 years or older or who have a family history of a genetic disorder, microdeletions seem to occur randomly, which means they don't usually run in families and equally affect any baby regardless of other factors. Okay. Okay, it says here, will a NYPT include microdeletions? One test that is widely of order after 9 weeks is NYPT. It's a blood test. It says here, it screens for most common chromosomal disorders. Trisomy 21, Down syndrome, trisomy 18, Everest syndrome. Please excuse me if I'm not pronouncing correctly. And trisomy 13, Patel syndrome. Some of these may detect specific microdeletions. It says here it has a 99% overall detection rate of chromosomal abnormalities. It is still a screening test, but it is not definitive. So it says here, if your family has a history of intellectual development disorder, you may want to consider going beyond NIPT and having your practitioner order other tests, such as amniocentesis or chorionic villus sampling. And I heard that some of these tests may pose some kind of risk, but I am not extremely knowledgeable on that because I have never had to get that done. And like I said again, this is no medical advice, no professional advice whatsoever, no financial advice. I understand that some of these tests may not be covered by insurance. Not one test at all is 100%. So even if somebody tells you everything looked perfect with the baby during an ultrasound or anatomy scan, or even with an NYPT test, or even with an amniocentesis, excuse me for the pronunciation, or a microarray test, any other kind of invasive tests, there is no guarantee that the test is 100% accurate. It may go silent. Again, it may be silent. Okay. So the whole point of discussing all of this is because it's not because, you know, a gypsy shouldn't have kids or anything, because nobody should be told that. I am not going to comment on whether she should have kids or not due to the severity and the nature of this case. It's so delicate, I'm not going to tell you my opinion on that. But in general, the point of me discussing all of this is because if baby comes out with the genetic condition and baby needs a lot of medical surgeries and attention, then it would, in my opinion, go against her narrative. And with this, I wrap up my video today. I hope you found this video useful for any kind of research that you are doing. I hope you have a good day. And again, thank you for watching.